The NHS can be saved. Keir Starmer's response to a damning report into the health service.
The NHS may be in a critical condition, but its vital signs are strong. And we need to have the courage to deliver long-term reform. Major surgery, not sticking plasters.
But on the same day, new data revealed this summer was the busiest ever for A&Es in England. The Prime Minister refused to be drawn on when patients would see improvements. If you were to speak to one single patient who's been suffering in agony for so long, what would you say to him or her about how you're going to fix the NHS and make them better in the short term?
I accept the challenge to me, which is it's going to take a long time. It's going to be measured in years, not months. And we need to have something to say for someone who's ill now, which is getting the NHS back on its feet. But we can't duck the long-term change. Through the central bit.
The Prime Minister's speech followed the publication of an investigation by Lord Darzi, which found waiting lists and waiting times are surging, with A&E queues more than doubling in the past 15 years. Too much of the NHS budget being spent in hospitals and too little in communities. And the UK has higher cancer mortality rates than comparable countries. Many of the problems identified by Lord Darzi in his report are already well known, but now they've been laid bare in a government report. It's up to Keir Starmer to tell us how he aims to fix the NHS. But today there was no detail. There was an overview of the 10-year plan and a promise to tackle waiting lists, but not much else.
So what are the appointments looking like now?
Moving care out of hospitals and into communities will only happen with the support from NHS staff in primary care, but they're already struggling with workloads.
It's a better model, it's what patients want, but it can only happen if we're given the resources and tools. So we need to have enough GPs working. We need to have other primary care staff. We need to have buildings that actually can accommodate us. I couldn't come into my own practice this morning because we didn't have the rooms.
The government also wants to focus more on preventing illness. Restrictions on advertising for junk food touted today as a new way to keep children healthier. But so too is improving access to care.
Stephen, do you want to come on through?
Right. Steve Can is a cancer survivor. Now he's having tests for numbness in his feet. Steve is typical of patients with more complex health needs.
Ringing up for an appointment is difficult because you end up in a queue. But I say if I turn up there at 5 to 8 in the morning, I always get an appointment with the doctor that I've seen for many years.
If you want to just rest your arm on here for me.
The scale of the challenge to transform the NHS and the lives of patients like Steve is huge. Too much time has already been lost. Ashish Joshi, Sky News.